Did President Trump just fundamentally alter the path of childhood vaccination in America? The ink is dry on an executive order that could reshape health recommendations for millions, and it's already sparking intense debate across the nation. Before we dive into the complexities of this significant move, if you want to stay on top of everything happening in U.S. politics, hit that subscribe button right now and leave a like. It really helps this channel grow and ensures you don't miss critical updates like this one. So, what exactly did President Trump do? Earlier this year, the Department of Health and Human Services, or HHS, put forward a proposal to adjust the childhood vaccine schedule essentially, to reduce the number of vaccinations currently recommended for children. Now, President Trump has officially backed this initiative with an executive order signed on Friday. The administration stated rationale behind this decision centers on their commitment to protecting religious liberty and parental rights in healthcare decisions. President Trump has consistently voiced support for parents' rights to make choices for their children, particularly when those choices involve deeply held religious beliefs. This executive order is being presented as a tangible step to reinforce those principles. This isn't just a minor tweak. The childhood immunization schedule has been a cornerstone of public health in the United States for decades, credited with dramatically reducing the incidence of once devastating diseases like polio, measles, and mumps. These schedules are developed through extensive scientific research and reviewed by leading medical experts at organizations like the Centers for Disease Control and Prevention, CDC, and the American Academy of Pediatrics, AAP. The idea of altering this established schedule, even with the stated goals of religious freedom, naturally raises significant questions about its potential impact. Who is most affected by this? Obviously, parents and their children are at the forefront. For families who have long sought exemptions from certain vaccines based on religious grounds, this executive order could be seen as a validation of their stance. However, for public health officials and many medical professionals, the concern is that any reduction in vaccination rates could lead to a resurgence of preventable diseases. We've already seen outbreaks of measles in recent years, often linked to declining vaccination rates in specific communities. The ripple effect of this decision could extend beyond individual families, potentially impacting the concept of herd immunity, which protects those who cannot be vaccinated due to age or medical conditions. What are the possible outcomes? On one hand, proponents of the order will argue that it respects individual liberties and religious freedoms, allowing families more autonomy in their healthcare decisions. They might point to potential side effects or the sheer number of vaccines administered to young children as reasons for a revised schedule. On the other hand, critics will undoubtedly raise alarms about the potential for decreased vaccine coverage and the subsequent increase in infectious disease outbreaks. This could strain healthcare systems, lead to school closures, and, in the worst-case scenario, result in preventable illnesses and deaths. The debate will likely become even more polarized, with scientific evidence, personal beliefs, and political ideologies all playing a significant role. It's also worth noting the timing of this. While the HHS proposal may have been circulating, the formalization through an executive order from the president gives it immediate weight and signals a clear policy direction from the White House. This move will undoubtedly be scrutinized by medical organizations, religious groups, and parents across the political spectrum. The legal and practical implementation of such an order will also be complex, potentially facing challenges in courts or requiring significant adjustments to existing public health infrastructure. This decision touches on a fundamental tension in modern society, the balance between individual freedom and collective well-being. How do we navigate these complex issues when deeply held beliefs clash with established scientific recommendations aimed at protecting the broader community? So, what do you think about this? Is President Trump's executive order a necessary step to protect religious liberty and parental rights, or does it pose a significant risk to public health? Drop your opinion in the comments below. I read every single one. This is a developing story with far-reaching implications, and staying informed is crucial. We'll continue to follow it closely.